Hi, I'm Greg Fell, Director of Public Health in Sheffield. This is a COVID update, dated 27th of July. Epidemiology first. Most of you will have clocked that we've been in the midst of a BA4 and BA5 wave. Looks like that's peaked, perhaps too soon to be definitive, but certainly some of the epidemiology is suggesting that that's peaked and that will wane. As with all previous waves, it will wane much slower than it peaks. The tail off is much slower. There's been a lot of it around. It's still probably a lower acuity illness, i.e. milder illness. Certainly in those who are well vaccinated, perhaps a bit more equivocal in those who as yet are unvaccinated. It's still making people poorly. I know plenty of people who are really pretty poorly. I know plenty who've had it mild as well, but I know plenty who are poorly. And there are people who are hospitalised, and sadly that will be the feature of the future. There will be other waves of COVID going into the future. It's impossible to predict when, where, and how they will look. Kind of key messages for me. Vaccination is the most important. It has served its purpose well. It continues to serve its purpose well. It's holding us up. It does not prevent transmission. It reduces the chance of transmission, but it significantly reduces the chance of serious illness, hospitalisation and death. That has been a feature throughout, and that's continuing. Be fully up to date with vaccination. I should come back onto that at the very end. If you have symptoms, don't go out. Particularly don't go and visit vulnerable elderly relatives if you've got symptoms that you think may be COVID. You can choose to or not choose to wear a mask. If you choose to wear a mask, then you are protecting yourself, but you're also protecting others, and I would still encourage people to think quite hard about that one. And open windows. Ventilation still matters. Do things indoors, do things outdoors rather than indoors. On vaccination, the additional groups set to be offered the COVID-19 booster, the fourth vaccination, and the flu vaccine in England will be all adults aged 50 plus. Secondary school children in years 7, 8 and 9 will be offered the vaccine in order of school year, starting with the youngest first. We don't yet have confirmed dates for the rollout of the flu and COVID booster in the autumn. We will communicate that as soon as we possibly have that information. Sheffield's seeing a large number of people coming forward for COVID vaccination for travel purposes, just oncoming summer holidays. Many people are coming to get their first ever COVID jab, and thank you for choosing that if you have done that. Families are stepping up and getting children vaccinated across all ages. It's never ever too late to get COVID vaccine. Our COVID response hub team, in partnership with the teaching hospitals, is open at 10 till 3 at the Moor Markets on Tuesdays, Wednesdays and Thursdays through the whole of July, August and September, and all of the places where you can get your COVID vaccine are available on the NHS and Council Twitter feeds.